deals with a difficult and potentially triggering topic. We will be discussing self-harm and suicide. We do want to give anyone who feels uncomfortable the chance to mute their TVs or possibly change the channel and return in the next 5 minutes. Suicide is the 12th leading cause of death in the U.S., and it's claimed more than 45,000 American lives in 2020. And now advocates are bringing awareness to a behavior that may be a precursor in hopes of saving lives. We are talking about self-harm, and we do want to give people the tools and resources to support themselves or loved ones through episodes of self-harm. Joining me live with expert insight is registered nurse Meg Harrell. Nurse Harrell, welcome.
Thank you.
We want to start off today by defining what self-harm is and the different forms it can take.
Absolutely. So self-harm really is injury to yourself, and it comes in a lot of different forms. It can be cutting yourself, hitting yourself, burning yourself. On individuals who practice self-harm, you may see an abundance of cuts, scratches, or bruises, or intense rubbing specifically in one area. And they're really just trying to release intense emotions related to trauma or stress.
And as we mentioned right off the top here, some experts say that self-harm may be a precursor to suicide. So tell us what that means.
Yes, self-harm does not necessarily always mean an intention towards suicide, but it can be a precursor. So it's important to understand that the individuals who are practicing self-harm it really comes from a place of pain. It comes from being emotionally upset, and because of that pain, they are not able to cope, and it comes out in these types of ways. So it is important to catch it early because it is a precursor to the act of suicide.
And you mentioned a couple of ways we might be able to tell if someone is struggling with this. Are there any manifestations that are something other than injuries to oneself, something that might lead us to believe someone is committing self-harm?
That's a great question. Yes. So if you're looking at an individual or your close loved one or somebody that you suspect, you really want to create an atmosphere of kindness and understanding. A really non-judgmental approach to the person is going to be a huge deal. Now, when you're observing them, you can observe for those injury things, but another big precursor is that they are wearing big and bulky clothes. They're wearing long sleeves, even when it's warm, to sort of hide some of the self-harm. There is a shame component that comes with it. Disinterest in previous hobbies, activities, and friends, withdrawing from things that used to be of interest are big precursors.
And I'm sure this is a difficult topic to broach with any person that you love who is dealing with this, but especially when we're talking about maybe a parent to a child or a teen, that could be especially difficult with the parent perhaps having a really big reaction because they're afraid for their child. How can you prepare yourself to have this difficult conversation with someone you love?
I think the first thing that you need to do is realize your emotions and you're upset. Bring them down a couple hundred notches if you can. The emotional response of especially a parent can cause the teen to shut down and to not want to share their feelings, and it actually compiles the shame that they can be feeling. Again, a non-judgmental environment is going to be the best way to approach this person and understand that this is not a phase. It is not a mood swing that the person can be going through. We need to identify it as a real problem and something serious.
And I think there is often with this topic the misconception that you can somehow force somebody to stop, whether it be by trying to remove things from them or perhaps monitoring them even more. But talk to me about the best way that we could potentially see some change in behavior.
I think looking at it without a stigma is going to be a really beneficial way to approach it. Realize that as medical technology advances, we can see in mental health the chemical imbalances, and we can diagnose it the same way that we diagnose cardiovascular disease. It is measurable, and therefore it needs to be treated. And then as we're approaching these people, let's try to identify self-harm triggers, listen to them as they are talking about where their pain is, where it comes from, and then please find professional help. Seek support from a therapist.
Talk to me about the best ways to make that decision as to what mental health professional will work for this situation, because it is just so much to handle alone.
Yes, and if you are by yourself, I really encourage you to take advantage of the resources out there. There are so many resources, and if you don't have one readily available, you can always text 988 for the National Mental Health Crisis Line. Also, mentalhealth.gov has a lot of resources specific to communities where you can put in your zip code and find communities specifically for teens and veterans and high-risk people, specifically around self-harm and suicide.
And in your expertise, is there something that you can say to viewers about there always being hope? I know that weight people feel must just be unyielding, but what can you say about moving past this eventually?
A couple of things: that it is treatable. A lot of people think, well, I must be crazy, and they put the stigma on themselves. But again, this is measurable. It can be treated the same way that we treat cardiovascular disease, a broken leg. There are ways to fix these chemical imbalances. It's really important to seek professional help. There are professionals who are trained in these types of scenarios and that want to help you. And personally, from being at funerals from friends who have carried out the act of suicide, I can tell you there's a lot of people who love you immensely that you may not even realize.
Nurse Meg Harrell, thank you so much for your insight today.
Thank you for having me.
And again, it is important to remember you are not alone. If you or someone that you love is experiencing suicidal thoughts or self-harm, there is help for you. The National Suicide and Crisis Lifeline is staffed 24/7 every day of the year with people on the other line ready to listen and to help you. All you need to do is, again, to dial 988, both texting and calling at that number available.